I would like to thank first the RSSDI and President Dr. Banshi Sabu, who asked me to speak on the subject of history of diabetes in India, a subject which is close to my heart. And I would like to dedicate this presentation to fathers and forefathers who greatly contributed to Indian diabetology. So I would begin with antique period. India had known about diabetes since Vedic period, any time between year 3000 BC to year 600 BC. Hindus of ancient India had recognized honey urine even 10 centuries earlier than the Western world realized the sweet taste of urine as a sign of diabetes. Indian physicians like Charaka, Susruta, and Vegabhata contributed greatly to the knowledge of Pramaha and Madhumeha, the two interchangeable terms for diabetes in their respective comprehensive Ayurvedic treatises. This is Charaka, popularly known as Indian father of medicine. As Dr. Anil Boraskar just mentioned, he lived in 400 to 500 AD, and he was the person who discovered sweetness of urine, and it was found out by approach of flies and ants. This is another important physician, Susruta, again in the same period. He even described two types of diabetes, the lean type and obese type, in his treatise Susruta Samhita, and these two types correspond to the modern day type 1 and type 2 diabetes. The third person of the antiquity was Vegabhata, who lived in 7th century and described the prevention and management of Pramaya and Madhumeha diabetes in his treatise called Ashtanga Hridaya. The fourth scripture in times of antiquity is Madhava Nidanam. It was written by Madhava Kara in early 8th century, and this scripture gave an excellent picture of diabetes in this treatise. Then we move on to the Dark Ages. Now, Dark Ages, like elsewhere in the world, they continued from the 9th century to about 15th century as far as the globe is concerned, as far as the rest of the world is concerned. Nothing much progress happened in many fields, including diabetology. But as far as India is concerned, this dark period was little beyond 15th, 16th century, because it was at the time before and after the British came to India and ruled us, first as a East India Company from 1757 to 1857, and then directly ruled as per British Raj, and until we became independent in 1947. So we would call this as pages of the Dark Ages, and that included the medieval period. And then we come to the 19th century until we became independent, and I would call this period as diabetes in pre-independence India. It appears from all the records that Calcutta was the initial center of diabetes related activity, which slowly expanded to Bombay, that is Mumbai of today, and then to Madras, that is Chennai of today, and then finally to Delhi and other one-tier cities of our country. The initial contributions from Calcutta included a contribution of an individual called Dr. J.P.
Sir, you are unmuted, please.
Yes, I'm now. Can you hear me?
Yes, sir.
Okay. So J.P. Bose had opened the first diabetes clinic in Calcutta in early 1900s, and he was the first one to have administered insulin treatment from 1924 itself. That is just within 2 to 3 years of the discovery, marvelous discovery of insulin. The other actors who were active in Calcutta were K.C. Bose, C.L. Bose, E. Waters, B.C. Sen, K.P. Gupta, A. Mitra, and another person called Dr. T.M. Nair from Madras. And these people described the diabetes and its characteristics, observing both the acute and chronic types, and they found that they were both on rise in prevalence, and it was basically a upper middle class and rich man's disease, and not of lower class and not of women. And yet, in spite of the fact that fish, milk, and dal were protective, the rich people who were able to afford this, they were still getting diabetes. Some of these scientists had propounded causes of diabetes as we now know as rich right lack of exercise, etc., but peculiarly enough to even other factors like insanitation, early marriages, and excess sex. During that time, indigenous medicines were already in great vogue before insulin discovery, and even after the discovery of insulin, they were continued by various physicians for the treatment of diabetes as far as India is concerned. Now, these are the three bosses. Kailash Chandra Bose, who was awarded Order of the British Empire, Chunilal Bose, and Jyoti Prakash Bose, whom I had referred to earlier. I call these three bosses as the bosses of diabetes from Calcutta. And the others, I have already named some of them like B.K. N. Chatterjee, K.P. Gupta, B.C. Sen, A. Mitra, E. Waters, and M.K. Chhatri from Calcutta, and one Chennai T.M. Nair. Dr. M.K. Chhatri, I think some of us have seen, I have seen him. He was one of the early members of the RSADI, and I believe he lives in Calcutta and he's around 100 years of age. He had a great contribution to make to diabetology. Then we continued for this 19th century period, that is diabetes in pre-independence India. And I have to say that despite insulin discovery in 1921, India had all pervasive continuing belief in culturally distinctive approach to diabetes, as it was reflected by serious attempts made by Indian diabetologists and the British diabetologists who were working in India of politicization of diabetes, tropicalization of diabetes, and racialization of diabetes. By politicization of diabetes, I mean to say that colonial British establishment, who was seized of infectious diseases like smallpox, malaria, and cholera, they were not very much interested and gave little lesser importance to a disease of diabetes. But the doctors who were working, the medical profession was constantly trying to draw the attention of English people that diabetes is also on the rise and it is important to be looked at. As far as the tropicalization of diabetes is concerned, I think Indian doctors made it abundantly clear to the world that diabetes was much more common amongst Indians compared to the foreigners in the scale of its prevalence. This was also related in some way to the dietary practices prevalent in India and other tropical countries. Probably it had something to do with the context of climate that was prevailing at that time, is still prevailing in tropical countries, and it is something to do with the stress, struggling with the modern stress of urbanization and other modernity. Racialization of diabetes are brought into the picture because most people at that time agreed that certain races within India were more sufferers of diabetes. Like according to one study, Hindus were having 65% of diabetes, while Muslims 22%, Europeans only 7% have diabetes, and remaining others 6%. And amongst the Hindus, the rice eaters had more of diabetes than the non-rice eaters. So now we come to the next part, that is diabetes in independent India. That is the first 3 decades, 1947 to 1977. Separating the first 3 decades from the recent decades makes a sense to me because these first 3 decades, events during that decade may be relatively unknown and may have already been relegated to history for the current generation. This account is therefore about the events that unfolded during the early 3 decades and may well have gone into oblivion with the passage of time. During the independent India, in the early stages, it was seen that poor people too began falling prey to diabetes. It was no longer only a rich man's disease. Concept of tropicalization continued. World congresses held on diabetes in tropics, at least 5, 1966, 81, 84, 87, and political sensitivity because of the increasing prevalence of diabetes across all types of population segments, it increased. But the racialization was more or less demolished. Nobody at that time believed that certain races within India were more suffering than the other races. So the early actions, as I told you, after Calcutta, Bombay and Madras became the initial centers of diabetes-related activities. Both Bombay and Chennai opened the first diabetes clinic in 1948 in the western and southern part of the country, respectively. It was followed by Delhi, and these clinics then multiplied in other one-tier cities and other cities now. Immediate concerns were managing these diabetic patients who are still not very common, and educating the public at large was a great concern about the disorder, but the research was still on the back seat. Other early actions, I would like to say the Diabetic Association of India was founded in 1955, and this association then established All India Institute of Diabetes and Mumbai Research Society for Study of Diabetes in India, established in Delhi in 1972 with MMS Ahuja and like-minded diabetologists like O.P. Gupta, B.B. Tripathi, M. Vishwanathan, Sam Moses, and others as founding members. Shining bright, RSDI showcased its countless activities in the last 50 years, including the latest 100 million persons glucose testing in 100 days and 1 million on a single day that goes by the name of Defeat Diabetes campaign. And this was a milestone, a milestone which found its way into the Asia Book of Records, where it is duly registered. These are the pictures of some yesteryear diabetologists of independent India. On the upper left side, it is MMS Ahuja. This photo was taken in 1967, that is about 55 years before, at Nal Sarovar Lake near Ahmedabad. Professor Ahuja was not only a man of great scientific acumen, he was very friendly with his junior colleagues as well. Then Dr. O.P. Gupta, who was the first president of RSDI in 1972 to 73, then B.B. Tripathi, RSDI president in 1974, Vishwanathan, president RSDI in 1978-79, Sam Moses was president RSDI in 1975, and finally, another great man is Dr. J.S. Bajaj, who had become, along with Bombay's Dr. S.S. Ajgaonkar, as honorary presidents of IDF, and later on, Dr. J.S. Bajaj even became the first elected Asian president of IDF from 1985 to 1988. So we then move on to ushering the era of research as far as the diabetes is concerned within our country. As you realize that in India, in the initial years, only clinical and epidemiological research was pursued at some length. Unusual forms of diabetes like pancreatic diabetes, J type of diabetes, malnutrition-related diabetes, and ketosis-resistant young diabetes reported from Trivandrum, Cuttack, and Delhi respectively caught the world's attention. Experimental diabetology, the twin sister of clinical diabetology, as it is known by Lawrence of England, was pursued mainly from Delhi to begin with to unravel the pathogenesis of unusual forms of diabetes reported from India. As a part of this, cumbersome bioassays based on animal experimentation were set up to investigate insulin-like activity, including total insulin-like activity, TILA, suppressible and non-suppressible insulin-like activity like SILA and NSILA in diabetics, because hormone measurement kits were just not available at that time. To understand metabolic abnormalities with diabetes, clinical diabetologists, including Professor M.S. Ahuja, took upon themselves to revamp their laboratories. They started to perform diabetes-related biochemical tests, maintain animal house facilities, carry out the procedures like raising insulin antibodies in animals, and performing isotopic labeling to set up radioimmunoassays in their own laboratories. A large number of published observations on pathogenesis of different clinical types of diabetes were therefore generated. Sundry clinical reports of etiopathogenesis, diagnostic criteria, complications, and treatment diabetes kept appearing in the Indian literature. Importance of even glycemic variability was recognized rather crudely. That meant only the avoidance of only gross hypo and hyperglycemia, and attempt to employ Schlitzschul's M value for ensuring a smoother diabetic control was also made. Last part of my presentation is about unfolding the Indian diabetology before the international community. Few Indian scientists in the 50s and 60s had a chance to see global development and progress in diabetology at a personal level, except to attend diabetes in tropics congresses in their own country, or at the most in neighboring countries. In 1974, Harry Keene, discoverer of microalbuminuria, invited participants from 14 centers across the world, including one from India, to a WHO London meeting on epidemiology of diabetes and its vascular complications. The first RSSDI monograph appeared in 1974, titled Book on Disorders of Carbohydrate Metabolism, with contributions from Indian and foreign scientists of great repute at the time, was reviewed in 1976 by no other than Dr. Max Ellenberg, immediate past president of ADA and a co-author of 1962 diabetes book, authored jointly with another eminent, Harold Rifkin. American diabetologist, the Kelly West, father of diabetes epidemiology, published responses of 20 eminent diabetologists, including one from India, on the question of diagnostic criteria of diabetes in American Journal Diabetes, and this happened in 1975 on the title which is indicated on this slide. Continuing with this same exposure to the international community, the only one so far in our country, 9th International Diabetes Federation Congress, was held in Delhi in 1976, where a large number of eminent diabetologists from all over the globe descended to this event. Following is Dr. Ajgaonkar's welcome address at this IDF satellite meeting held at Bombay on epidemiology of diabetes and vascular complications, where he introduced Indian diabetologists to international audience at Bombay. Proceedings of this satellite meeting were edited by no other than Harry Keane of microalbuminuria fame, J.C. Pickup of CSII fame, and Dr. C.V. Talwarkar. Indian diabetologists, I would say, continue till today to report in the international and national literature additional forms of diabetes like low-weight type 2 diabetes, Asian Indian phenotype, the thin fat Indian, and unique clusters of type 2 diabetes, which are important for the prognosis and management of the disease, and therefore contribute to reinforce diabetes as an emblematic disorder of evolving heterogeneity. I would like to, in the end, briefly mention that there were many research ideas which came and went. This is not true only of India, it is true of the whole world. For example, from the Indian perspective, J-type diabetes and MRDM, much talked about in the past, have gone into oblivion. Usefulness of high carbohydrate diet in diabetes, I remember, was propagated by M. Vishwanathan. This is no longer considered valid. Angiopathies were considered at that time as completely unrelated to control and duration of diabetes, an idea which is hard to digest in the current time. Usefulness of bioassay-based TILA, SILA, NSILA, spin albumin in the pathogen of diabetes is no longer believed. Exclusive M value as a measure of glycemic variability has been surpassed by newer methods like TIA. Erstwhile usefulness of dirty insulins, first generation sulfonylureas, and the bigonads like fenformin have also been consigned to the forgotten past. In summary, therefore, thanks to the diligent and brilliant minds, ancient and modern contributors of diabetology are testament to the fact that India was never a late starter. Despite global phenomenon of rise and fall of many research ideas in the past centuries, diabetes in India is set to rise and rise. Eradication of malnourished J-type of diabetes in young people from our country over the years is like a landmark in slow motion. Defeat Diabetes campaign is an unmatched feat of our current times that will go down in the history in golden letters. I leave it to some other day and some other person to narrate the history of recent decades once they begin to be forgotten, and to trace the history of RSDI on completing its 50 years in 1922. My acknowledgements are to Anil Bharaskar, Vishwanathan Mohan, Siddharth Das, who gave me telephonic consultations while I was writing this chapter and also preparing these PPTs. This historical account was synthesized from its references over a period of more than 150 years, 1866 to 2021, and its cross-references of even earlier years, and comprises description from direct witnesses also. I have all the references. If anybody wants, I would like to share with you. Thank you very much again for patient listening, and would like to be engaged in discussion on this interesting subject. Thank you very much again.